Hi, everyone. Welcome. My name is Angela Love-Zaranka, and I am here with my colleague and partner, Sekeita Lewis-Johnson. Sekeita.
Hello, everyone. Thank you for joining us this afternoon. It's a pleasure to be here to really talk about my passion, which is being an IBCLC. So thank you for joining us.
Yes, thank you. So I have been a board certified lactation consultant for over 30 years. I started out, or 25 years, I started out in community support 30 years ago. And so I have been a member of both the IBLCE, the credentialing body's board of directors, as well as ILCA, the International Lactation Consultant Association, which is the professional association for lactation consultants. And so welcome today. Sekeita, would you like to provide a few of your
Yeah.
credentials and background?
So I bring you greetings from being a nurse for over 25 years, but I've been a lactation consultant almost 15 years. Next year, it'll be 15 years. Also had the opportunity to work in hospital settings as well as in community settings. I have a private practice, and I am actually a board director for the United States Breastfeeding Committee. So yes, it's just a little bit about me.
Yeah, so we'll go ahead and get started. First, let's talk about where you can communicate with us, how you can ask questions. So if you're on a desktop or a laptop, take a look at the blue arrow, and in the middle of the control panel, the GoToWebinar control panel, you'll see a spot where it says questions. And so you can type your question and or type any comments that you would like into the chat. If you're on a mobile device, you'll find it, if you'll notice the green arrow here, it's at the bottom of the GoToWebinar interface. And so feel free to type in any question that you have. And actually, to get started, why don't you type into the question box where you are participating, where you're listening to us from today. And it's always interesting to see where in the world everyone is located. Okay, so we also have a couple of folks from our customer support team. We have Julie and Wendy. Julie is also an IBCLC, and Wendy has been with us for, oh goodness, I want to say probably close to 8 years. So she's very well versed in handling any sort of question that you may have regarding the process to become a board certified lactation consultant. They will answer the questions in the chat, but they're going to leave a couple for us so that we can answer them live. Also, Jill from our amazing tech team is also on the call, and she can help you with any tech issues that you may have. If you're watching this recording on YouTube, please post your questions in the comments below. You can also contact our customer support team at support@lactationtraining.com. So let's dive in and take a closer look at what a lactation consultant is and how you can follow your passion and become one. If you decide to become an IBCLC, you will join more than 34,000 IBCLCs in over 129 countries and territories. Credentialing as a lactation consultant is offered by the International Board of Lactation Consultant Examiners. Take a look at their website, IBLCE.org. They have different regional offices depending on where in the world you reside or work. Review the requirements and pathways to become eligible to take the IBCLC exam. What do you need to know? Well, there's something called the Detailed Content Outline. It used to be called the Exam Blueprint. It's based on surveys of IBCLCs in various practice settings around the globe. The outline covers all the topic areas and the chronological stages an IBCLC needs to know in their work. LER's courses cover the entire detailed content outline, and our courses are approved by LARC, which is the Lactation Education, Accreditation, and Approval Review Committee. That's the organization that evaluates and approves lactation consultants training courses. Sekeita will review a few questions to ask yourself today before you get started. Sekeita?
Thank you, Angela. So the topic of this webinar is the realities of being and becoming. And so I don't want to scare you off. There's a lot of stuff that Angela and I will go through. But I'm going to start off by asking you to do a little bit of reflection as we are going through this presentation. So before we begin, while you're hearing it, and you may want to write these questions down, just saying, but think about, do I have these skills, right? Do I have these skills to become an IBCLC? Now, I would not expect everyone to have the skills right now because you're interested in learning. But the other thing is if you answer, no, not quite there yet, where will you get these skills? So I want you to start to really think about that as we start to talk, because when I say skills, I mean more than just hands-on tasks. I mean a whole bunch of other things, and we're going to get off into those things. So keep those questions in mind today. Right, so what makes an IBCLC? C, competency. The first thing I will say is competency in any field. And just for kicks and giggles, competency is really the ability, the knowledge, and the skill to do whatever you're trying to do successfully. And I would say that being an IBCLC and having the competency to deal in problem solving, we're going to talk about problem solving, is crucial to what we do. Simply because if you're in, for instance, if you're going to get heart surgery, you would want your heart surgeon to be real knowledgeable and skillful on how to perform whatever procedure. And that is the same responsibility that we hold as IBCLCs when it comes to infant feeding and lactation. All right. Culturally appropriate and credibility. One of the things that we talk about is really unpacking what it means to be sometimes culturally, you'll hear culturally competent, sometimes you'll hear culturally relevant. So if you've been around healthcare especially, you will hear some of those terms. However, I like to think of culturally appropriate, because when I think about competency, competency is something you master, right? And when you think about cultures and subcultures, sometimes you just can't become fully competent in someone else's culture unless you are living, breathing, and eating that particular culture. So we need to be really clear on what these terms mean, because if we're not, then we show up in spaces and we can cause harm as IBCLCs. And so you will really think about this as a sense of really examining your own self, your own values, your own ideals, and that is really cultural humility. So cultural humility is a lifelong self-reflection and self-critique where we're learning about ourselves as we interact with other people and their cultures. So being a culturally appropriate starts with cultural humility, which is that inner reflection. Once you are really working in the field, and I want to talk about cultural humility real quick before I move on, is that cultural humility, you will see there's a lot of terms about culture. There's something called, it escapes me, but there's a whole nother term now about this. And so this is a growing field that some of the definitions will evolve, but anyways, it's just making sure that you are not causing any harm. So when I say that, I mean, it's quick to think about cultures as, and I remember someone saying this, like, oh, they're such and such, they don't breastfeed in the first couple days. So we sometimes say that's a cultural thing, when sometimes that's really not a cultural thing. Maybe it could be because there's a myth that needs to be dispelled. Maybe it could be an education piece that's lacking. So just making sure that we're clear. Once we make sure we're clear and we're causing no harm, that's how we become credible. Really, credibility stems from knowing when you have the correct answer, and when you don't have the correct answer, where do you go and get it. Sometimes as IBC, a lot of us get into this because of our own experiences, our own breastfeeding or chest feeding experiences. And so sometimes someone will ask you a question and you will base it off of what happened with you. And I just want to challenge you and to think broadly about, was that something that was just specific for you? Or what does the literature say about whatever the question is you've asked? And do you know how to go and look that literature up before you give information that may not really be applicable to that particular person? So just wanted you to know that being a credible resource means you're giving out information that A, coincides with the best evidence, and B, you really know what you're talking about. Now, we're not all walking dictionaries, right? We don't all walk around with computers in our heads because now everything is at the click. We rely on computers to do everything for us. But what I'm saying is understand that if you're asked a question and you don't know the answer, it's okay to say, I'm not quite sure. Let me get the answer and I'll get back to you. Perfectly fine, because credibility is everything. If you lose credibility as a lactation consultant or supporter, it could really translate to other IBCLCs losing credibility. And that's definitely not where we see this profession and credential going. All right. Also, IBCLCs are policy advisors and creators, and we're also advocates for just policies. And so a couple things that we do, we advise on policy, we actually help create policies, and that's important to know because from a clinical standpoint, you need to really understand the language in policy sometimes can have indirect consequences. So language is everything. So remember when I talked about policies and when I talked about skills earlier today, I said, ask yourself if you have the skills necessary, right? Recognizing that IBCLCs, we come from all different professional backgrounds. If policy is your area of expertise, I would say that's one thing you got down, that's your strong suit, that's great. But let's just think if policies is not your strong suit, that's okay. Being in the room, listening to the policies, listening to the language of the policies, and then having input on those policies. So it really means, you know, that there's space for everyone in this arena, because that policies actually also policies as well as unjust things inform our advocacy. So I would say as regarding any topic that relates to infant feeding, human milk feeding, breastfeeding, and chest feeding, it's important to know that you are, if you become an IBCLC or CLC or CDS, I'm sorry, all of the credentials is that it's important that we are stakeholders for anything that's lactation specific related to policies. All right, so advocacy is a big part of what we do and who we are. A person who advocates. I'm talking real fast. It's simply a person who publicly supports or recommends a particular cause or policy. So if you're not a policy advisor, so to speak, you can be that person, again, sharing your perspective and advocating for your perspective and the perspectives of the clients and the community that you serve. Problem solver. So I mentioned problem solver earlier in the talk. I was like jumping ahead of myself. That's about 90% of what we do. I tend to think and to stay away from one size fits all frameworks. And as an IBCLC, we learned that. We learned that about 90% of what we do is individualized care, because not everyone presents with the same situation under the same circumstances. So be mindful about framing lactation concerns in this one size fits all framework. know that a lot of times as problem solvers, we have to try to figure it out, which means listening, authentically listening to our clients and our patients, hearing what they need assistance with, right? And again, that sometimes means saying, whoa, I've come across this situation, never had this situation before. Let me go back and look it up before I really try to advise or do something that may cause harm. So as far as a researcher, you can be, we have also in this field, we have IBCLCs that are researchers, do their own research. You can be a person who carries out academic or scientific research, or you can be that person whose job involves discovering or verifying information. And that's really all of us. Remember, we're not walking around with a computer chip in our head that's like, oh, I got the answer. That's not what happens. That's not real life. High-level lactation care, skilled high-level lactation care. Maybe I'll flip those for the next presentation, but they both go hand in hand. And I don't want to scare anyone, but again, these are the realities of becoming and being an IBCLC. So when we talk about high-level lactation care, it means care that involves a higher level of thinking and higher level of doing and being and a higher level of skill and knowledge. So I'll give you an example of someone that I would say is probably one of the highest levels that you can get. And I said probably, not the, but probably. But think about someone who's in an intensive care unit who is on life support with a breathing tube. They're intubated. And think about maybe some of the care that may be provided if you knew that their wishes were to provide human milk for their baby. So think about that, right? Are you able to deliver that type of care? Now, as someone that's just coming into this work, no, we talk about novice to expert. So yeah, when you come in, it's entry level, but the expectation is that you build your skills and you become that person who manages the complex clinical cases that you are bound to see in lactation land. And that's where when we talk about skill, we also talk about acuity, which is the level of care necessary for optimal outcomes. So when we talk about those skills, not everyone who goes through the clinical spaces will get that type of clinical experience, but you have to know that if someone came in with, for instance, brain damage and they were lactating, it's important to kind of understand, okay, the brain has been impacted. What can happen if the brain is impacted? The milk supply. It's really forming critical thinking around individualized special cases. All right, essential and timely. Wow. So one of the things we found out during the pandemic is that essential became a buzzword. And we also found out that IBCLCs are essential because babies still need to eat. People are still having trouble, having children, and especially during a pandemic, promoting and protecting the ability to provide human milk is critically important. So yes, we are essential, and it's important for us to show up when people need us in a timely manner. And when the pandemic first began, a lot of folks shut their doors, a lot of folks stopped seeing clients. But however, people were still having challenges, and more so challenges because they were away from family members. They were away from any person that could really truly assist during that postpartum time. So in saying that, understand that, telehealth is okay. And so we came up with workarounds to still provide some care to people, but sometimes telehealth just doesn't cut it. Telehealth can prohibit our ability to use our other senses. And so we want to be real careful about understanding our role in particularly assisting families at the point of time that they need assistance. Because if not, then that chances of premature weaning and all the other health outcomes related to premature weaning will there follow. And so again, that means being timely and showing up, because when we don't show up, we really are not practicing as a prudent IBCLC. Collaborative care partner and trusted. This is a phrase that I love the phrase collaborative care partner, because it assumes that you are collaborating with your client. You are not the center of, you are not the decision maker. And so remember this. So families, they have their partners, their goals, and it's really all of their subjective world and their own goals that takes precedence over your goals for them. So when I talk about this, some people cringe, so get ready to cringe. So I already know, we know that exclusive breastfeeding for the first 6 months, at least those are the recommendations, right? We know those things, but it's important that we still honor, and we still honor that, but we also leave space for clients to talk about their goals, to talk about what's going on, because also sometimes there's barriers that make it impossible, and there's policies that makes it impossible to exclusively human, provide exclusive human milk for the first 6 months. And so we really have to come in, we have to understand that we are in partnership, in agreement, that when someone seeks our care, that we make sure that we approach it in a manner where we're not overstepping our boundaries. And that's truly, that leads into how you become trusted. In all honesty, that's how you become trusted to do no harm, to be reliable, and you're trusted to really have the persona that says, I see you as a person. I see that we're in this together. I'm not higher than you. There's no hierarchies. It's just me going into this clinical relationship, right? And I talk about this from a standpoint of when you become an IBCLC, so I'm claiming it for everybody on this call. So when you become an IBCLC, it's important to be like, yep. I'm sorry, it's one of those things where people are like, yep, I'm the expert. I know all about this. I've been teaching and breastfeeding, chest feeding for 15, 20 years. I'm going to tell you how this should work, and you're going to be good. When you go in like that, people will be like, whoa, right? Because yes, you are the expert in your knowledge of the work, but you're not necessarily an expert in the client and the patient. And I always say that the family, they're the experts on their needs and their wants and their goals. So the other thing is you become trusted by asking for permission to touch. I can't leave this space without talking about that. When you go in and touch someone without asking permission, let's say, for instance, if they say they need assistance with latch, you want them to tell you what type of assistance they're looking for before you just go in and just be like, okay, here you go. You know, that's not a collaborative relationship. So I want to just leave that there. I want Angela to jump on in. And oh no, I think I got one more slide. I got a couple more slides. All right, person-centered care. So as I was talking about being the collaborative care partner, when you think about a lot of things I've talked about, I've already talked about culture, I've already talked about collaboration and the types of care we will deliver, and it all really centers the person, right? So the Institute of Medicine defines patient-centered care as providing care that is respectful of and responsible to individual patient preferences, needs, and values, and ensuring that the patient values guide all clinical decisions. So we hear a lot about evidence-based practice, right? And I talked about how exclusive breastfeeding for 6 months, that's evidence-based, right? However, we really have to, again, honor the patient's values or client's values. So with that being said, I am going to, the only other thing I want to say about this though, before I go here, but you can say here, Angela, is person-centered care has also become a buzzword. Don't let it become a buzzword for you. Really practice what this model looks like, and that would further build trust with you, not just with the client, but within your community, and also even with other clinicians that work around you. So keep those things in mind. So I am all about questions. I got a few more questions to ask yourself today. Angela is going to start to get into the nitty-gritty. And so when she's talking and speaking about the pathways, some questions you may ask yourself or write these things down is which pathway is appropriate for you? Also, what does your local market look like? You know, these are things you want to consider. Like a market analysis, how many IBCLCs are working? Do they primarily work in the community? Do they work in other places like WIC or hospitals, or is your area saturated? And I don't think any area is saturated, but I'm just giving you an idea of how to think about your local market. Also think about if there's any mentors in your area. Also, how does this fit with my lifestyle? As Angela talked about the clinical hours that are necessary, and the education piece that is necessary, really ask yourself, like with all my commitments, with my job, with my family, even with school, what does it look like? How does obtaining all the education and all the credits that I need to get, how does that fit in with what I'm doing? So I will turn you over to Angela as she gives us this course on how to become an IBCLC.
Thanks, Sekeita. Okay, great. So now I'm going to go over the basics and the actual how-tos. So the process can seem just a little bit complicated, and we've had a lot of questions in the chat, and we're answering those. We'll answer a few of them live, but just want you to know that becoming an IBCLC can feel complicated, but we're going to kind of give you a little bit of a roadmap on what to do. So the first thing you need to do is choose a pathway. We're going to come back to this in just a minute. Each pathway has 3 components. There's the education piece, there is the clinical hours, or there are the clinical hours, and then there's actually getting ready for the exam. So first, the first component is the health sciences education. It's a typical education for a healthcare provider. There's 8 post-secondary or university level courses and 6 general education subjects. You can find a full list of each of the 14 subjects on the IBCLC, on the IBLCE website. You can search for it, or there is a link. We have a resource sheet. If you go to our YouTube page and watch one of the previous versions of this, or watch this when it's released in a few days, or if you go to our website and see in our archives, we actually have that document attached to this recording. Unfortunately, on me, I forgot to upload that handout for you. So we will find a way to provide it for you, or you can navigate to our website or YouTube page and you can find it there, along with the recording. The 8 university level courses are, and you don't need to write these down, biology, anatomy, physiology, infant and child growth and development, introduction to clinical research, nutrition, psychology or counseling skills or communication skills, and finally sociology or cultural sensitivity or cultural anthropology. They can be online or in person as long as the institution is accredited to provide the learning. Now, LER partners with Union Institute and Walden University to provide the basic courses. Both organizations are online. The advantage of working with Union is that their program director is an IBCLC and has chosen the college courses which meet the IBLCE requirements, so you don't have to guess. If you want to get your bachelor's degree in maternal child health with a concentration in human lactation, take a look at Union. Another advantage is that both universities will accept federal financial aid. The 6 general education subjects are medical documentation, medical terminology, occupational safety and security for health professionals, professional ethics for health professionals, universal safety precautions and infection control, and basic life support. Now, 5 of the 6 general education courses can be taken through LER. The only one you're going to need to search for is basic life support. In many countries, there's an in-person skills check for this training. I've heard some organizations are providing this training completely online. Check with your local resources. In the guide that you'll find on the IBLCE website provides general descriptions for the typical courses in each subject area. Please keep in mind that the IBLCE is international. The names used in their document may not exactly match the course description that you took from your accredited educational institution. That's okay. IBLCE utilizes broad terminology with the understanding that there is no universal description for what a course in, say, clinical research is going to cover. Why are these 14 courses required? The IBCLC is a standalone credential, meaning you do not need another certification, degree, or license to practice as an IBCLC. Once you pass the exam, you will be an allied healthcare professional. The courses will help you to be prepared in your career as a healthcare professional and help you to pass the IBLCE exam. Now, the second thing you need is lactation-specific education. This is where LER has got you covered. The education should be comprehensive and cover the IBLCE detailed content outline. IBLCE requires at least 90 hours of lactation education, and then 5 hours on communication skills. Our 5-hour course is specific to lactation and breastfeeding care to help you in your practice as a lactation consultant. The third component is lactation-specific clinical experience. This can include in-person consultations, telephone consultations, or online breastfeeding and lactation care that supports breastfeeding families. Also includes lactation assistance to pregnant and breastfeeding clients and lactation education to families and/or professionals. These hours should be obtained within the 5 years immediately prior to applying for the exam. So how many clinical hours do you need? Well, that depends on which pathway you choose. Clinical hours, as I said, are accrued the 5 years before applying for the exam. And so here's a quick overview. Pathway 1 is for healthcare professionals and those who provide breastfeeding support through an IBLCE recognized breastfeeding support counselor organization. Healthcare professionals, according to IBLCE, include physicians, nurses, midwives, dietitians, physical therapists, speech pathologists, and others. Breastfeeding support counselors include those accredited through organizations such as LER, La Leche League International, and the Australian Breastfeeding Association. As of today, there are over 40 organizations that have applied to IBLCE and are approved. Pathway 2 applicants must complete a comprehensive academic program in human lactation and breastfeeding through an accredited university program. Their education has both didactic and clinical components, and they require 300 supervised hours working with breastfeeding families. Pathway 3 is a structured mentorship between an IBCLC and the applicant. The IBCLC or several IBCLCs must be in good standing with IBLCE. Those who choose this pathway must have their program pre-approved by IBLCE prior to beginning to accrue their hours. Now, I understand that this is happening relatively quickly these days, like within a few weeks. So a quick note, for those of you who have breastfed or chest fed or provided human milk for your child, the hours you spent nursing, pumping, and helping your friends doesn't count towards your clinical hours. Now, while 500 or 1,000 hours may seem like a lot, there's a good reason why. Each candidate needs to have the clinical experience necessary so they can provide competent care, as Sekeita mentioned, as an IBCLC. If it's any consolation, the number of hours that were required used to be quite a lot more. I've known Ibclts who needed anywhere from 2,500 to 8,000 clinical hours just to take the IBLCE exam. Candidates who apply for the IBLCE exam through Pathway 1 need at least 1,000 clinical hours. For the candidate who is also a healthcare provider, the hours can be done in a hospital, birth center, clinic, lactation care practice, or through independent practice as a licensed or registered healthcare professional in a non-healthcare setting. For breastfeeding support counselors from an IBLCE recognized organization, their hours can be earned in person or online. The location and type of support depends on the criteria provided by the recognized organization. The hours need to be counted on an hour-by-hour basis. Now, 2 important points about clinical hours. 1, it's important for you to document those hours as you accrue them. Be very detailed in case IBLCE chooses to audit your application for the exam. They may want to see documentation such as a spreadsheet or another document where you counted your hours. And the second thing is that the 1,000 hours do not need to be directly supervised. Now, Pathway 3 requires 500 hours of clinical experience. It's best done in a busy practice setting where you can work with many breastfeeding, chest feeding people, and those providing human milk for their babies each day, such as a clinic or a hospital setting. The hours count towards your 500 when you're actually working with families. Observation hours do not count. Clinical experience is graduated. That is, it starts with observation, then doing tasks under supervision, then completing tasks independently with the IBCLC nearby to ask questions and discuss situations. So LER has an internship program with many sites around the United States. You can reach out to support at lactationtraining.com and we can connect you with our clinical internship director, Amy Black, to determine if we have a site in your area. If not, we can give you suggestions on how you can work with your local hospital to facilitate an internship site. Now, one thing Amy wanted me to mention during this webinar is that you can't start to count your hours towards the internship requirement until both you and the IBCLC are comfortable with you working independently. Most interns spend about 75 hours in orientation before you can begin to accrue the 500 hours. Or you can take a look in your community to find a willing internship site or mentors. You may need to reach out to several people to find someone who has the time, experience, and capacity to agree to be your mentor. It's important to find a good fit. Talk with others who've been through Pathway 3 to find successful strategies with finding that good mentor. Now, while this pathway takes an additional step or 2, is it worth it? Absolutely. IBCLC reports that students who come through Pathway 3 score best on the exam. I believe it's the mentorship that is that key component. Learning from an experienced clinician is well worth the extra effort involved at the beginning of this pathway. Now, a lot of people are asking whether or not they can accrue hours via telehealth during the pandemic. The quick answer is yes. The longer answer is paraphrased from IBLCE documents dated 17 April and 6 October of 2020 at the beginning of the pandemic. IBLCE will allow the use of technology if certain parameters are met. You'll need to pay attention to privacy rules and the Code of Professional Conduct, as well as the clinical competencies for IBCLCs. Another important point is that there should be, quote, observation using technology with two-way synchronous audio and visual components, the focus being on the mentor providing the mentoring and guidance to the applicant. This guidance has been extended until 30 September of 23. It's important to read all of the IBCLC documents listed in the interim guidance. The link to the guidance is found in the resource document, which is located attached to the recording of this video. Now at LER, we have two ways to gather your lactation-specific education. One is the Lactation Consultant Training Program, or LCTP, which is the full 90 hours front to back. The other is either the core or bridge course. They're designed to meet your educational needs depending on your background and previous lactation training. First, we have a comprehensive course called Lactation Consultant Training Program. This is a 90+ hour course which is eligible for CERPs, which are Lactation Consultants Continuing Education Points, CME, Nursing Contact Hours, and CEs from ACNM. It's intended for those who do not have any lactation education and know they want to become an IBCLC. We have 35 of the most knowledgeable, experienced instructors who are practicing lactation consultants, researchers, and authors who teach our courses, including Sekeita and me. Our classes are economical. You can view them on a variety of devices such as your computer, tablet, or phone. They're optimized for a computer, but they can be reviewed later when you're on the go. We've been educating people in person and online since 1990. We update our course information with the latest peer-reviewed evidence on a regular schedule, but will update sooner as new evidence emerges. If you have questions for the instructor or want to discuss a concept with your fellow students, there are several ways to connect to get the answers you need. We have a very active Facebook group for our students who are in the 95-hour core or bridge course or the exam review, and our students can meet each other through that platform and support each other along the way. There are people who are also IBCLCs in the group, and they too can help to answer questions and support your journey. Upon completion of the 95-hour course, you're eligible to take the Certified Breastfeeding Specialist exam. The exam is included in the price. Once you pass, you are a Certified Breastfeeding Specialist. This is to recognize the level of education you have attained with this certification. You can begin to collect your clinical hours towards the IBCLC exam. If you're unsure where to start, or if you already have some lactation-specific education hours, then we have our core or bridge programs to meet your needs. They have the same advantages as the LCTP course. Our initial course is called Core because it will provide you with the core lactation education you need to understand what it means to begin supporting the normal course of breastfeeding. It's 52+ hours online. It covers the basics such as anatomy and physiology, infant growth and development, supporting the preterm baby, medications and breastfeeding, and many more. At the end of the course is the Certified Breastfeeding Specialist exam. The bridge course is ideal for people who have the basic lactation education components and need an additional 45 hours to qualify for the IBCLC exam. Topics in our bridge course include legal and ethical concerns for the lactation consultant, infant feeding and disasters, breastfeeding the infant with medical challenges, case studies, and clinical skills videos. Not sure where to start? If you're new to the profession, I would suggest the core course. Get your feet wet and see if becoming an IBCLC is the right fit for you. Our 90-hour course, as well as the core and bridge courses, are available in Spanish. Capacitación en Lactancia is our new website, which provides the same high-quality education found on LER in Spanish. At LER, we believe that access to high-quality lactation education should not be limited to those who live in countries with high incomes. We recognize that in many parts of the world, the relative purchasing power of a local currency may make the cost of lactation education inaccessible. As part of our commitment to increasing access to lactation training worldwide, our price is adjusted according to the student's country of residence. In alignment with our continued commitment to diversity, Lactation Education Resources is proud to announce our Rising Tide Lactation Equity Scholarship Program, designed to increase the number of Black, Hispanic, and Latinx IBCLCs in the United States. We recognize one of the greatest obstacles to entry in the field is access, specifically demonstrated by financial barriers. LER will remove that barrier for Rising Tide Scholarship awardees. We alternate these scholarships each year. You can find out more information on our website, lactationtraining.com/Rising Tide. Our team is here to help you now and in the future. We have tech support open 7 days a week. You can get your questions answered by content experts in the field, and we have ongoing support for the next steps in your lactation career. As far as that last point is concerned, I just want to mention that students reach out to us all the time. Someone reached out to one of our instructors with a question from their own practice. We were able to connect them with the instructor and their question was answered. Another one had a question about policy development, and we were able to find the appropriate instructor and connect them with creating a policy in their facility which met breastfeeding goals. So thank you very much for your time today. I know that the question box has been super active, and so I'm going to open it up for some of the questions that we have. Sekeita, have you triaged the questions yet?
Yeah, so there's one question. I'm going to pause on that because I'll come back to that. However, so we'll talk about this question. It says, I am a nurse RN who works for Nurse Family Partnership. I teach moms how to breastfeed prenatally as well as during postpartum infant stage. I want to do the 1,000-hour clinical hours and then possibly shadow and work with an IBCLC. Do you have any recommendations on how to get additional hours without having to pay, such as volunteer options? Okay, so.
Are you pausing for yourself or me?
So no, I'm pausing because I feel this question deeply, really. Because there's so many barriers, and when you think about having to pay for mentorship, sometimes that can be challenging. So what I often will say to folks is to develop relationships with local IBCLCs and develop relationships with IBCLCs that work in a variety of different places, because depending on where we work, it also depends on your true skill set or niche, right? There are some who work in outpatient settings. They see babies probably 4 or 5 days out from delivery. There's some people that work in the hospital. There's some people that work in the NICU. So you really want to get a vast knowledge if you're going to shadow of different types of settings that IBCLCs work in, outpatient clinic. So I would say develop a relationship, also be able to offer up something to someone if you're asking them to mentor you. Maybe not necessarily money, maybe a skill, maybe a talent. Those are some other ways that you could potentially get hours without having to pay. So that's what I have to offer. I'll ask Angela, do you have anything to add to that?
No, I would agree that bartering is the way to go. I know of a few limited paid internships in the United States, but they're very few and far between. And so it's not quite happening yet. And I do know that it is a barrier for some. And so yes, bartering with an IBCLC to support them in their work is always something which can be very popular for folks. So yes. There's another question here. Someone is almost done with their 90 hours and they need an internship and they're having a hard time finding a mentor and a clinical internship due to the rules at the different facilities and or lactation consultants in their area. And so indeed, you know, that is one of the barriers, is that you do need to comply with whatever rules in the hospital or the healthcare facility. You know, you do need to comply with those rules in order to be placed there as an intern if you're going through pathway 3. However, pathway 1 is the clinical hours, which will allow the person to do this sort of support unsupervised. And if you go through LER, we do have a Pathway 1 program that we're currently piloting. And we are trying to determine whether or not people can gather their clinical hours and what sort of resources it's going to take for LER to support this program completely and for everybody who wants to be an IBCLC. And so we're currently in the pilot phase of that, but do reach out to folks, especially since IBLCE has said that you can continue to accrue hours virtually. I know some people who have used several virtual mentors in order to support them in their work. And so if possible, and if it's something which would work for you, then yes, providing that virtual support is helpful. I also know a few people who really want to be an IBCLC and they feel frustrated, they have their timeline. And someone just asked me, right before this call, they want to know if you have to have all of your hours done before you apply for the exam. And the answer is yes. So even though they had planned to take the exam in, March or April of 2023, their application is actually due in December of this year. Therefore, they do not have all of their clinical hours, so they cannot. So they're going to have to push it back. And I know how frustrating that is to push back your dream. And remember that it's the journey and it's the adventure that's going to help you to be a better IBCLC. So even though you may not be able to do it as quickly as you want, try to remember those people who needed 8,000 clinical hours. By the way, that was 16 years of clinical experience before. And so, I know it's very little consolation, and yet that may be something which does provide you with just a little bit of solace, that as excited as you are about this, it'll still be there when the time is right and when you're ready. So there's that question. Is there anything else you wanted to add?
No, I just will go on to the next question. Someone is asking, what was the URL for the scholarship again? So
so it's lactationtraining.com/rising tide. I will say before you go quickly over there that we actually have just announced our 2 Rising Tide Scholarship awardees for this year. And so the next application will be open. It will be next year, probably around June or July-ish. You may want to check back and see. So that's when it should be available next year. Sekeita, there's a question here. Did you see the long one that we?
Yeah.
Okay, you're going to do that one? Okay, good.
I'm going to read it and I'm going to ask you to chime in.
Okay.
It says, hi, my question. I am a new lactation consultant at our local hospital. I am preparing to get my IBCLC certification. I have 21 years nursing experience and 6 years OB postpartum nursing experience. I've been a full-time LC for almost 6 months. We only have one other IBCLC on staff. We are both full-time. Often there presents a need to conduct an outpatient appointment on a mom who calls into our helpline for various reasons. Am I allowed to see these moms for latch help, nipple damage, infant weight loss, feeding plans, etc.? Our hospital has no policy specifics on whether the LC has to be certified to complete an outpatient assessment treatment. Are there specific guidelines or stipulations within the IBCLE framework that would give clarification on this?
So the guidelines are not specific as far as inpatient or outpatient. And I think I know where you're going with this, Sekeita. Dealing with an inpatient or an outpatient lactation visit, they're 2 very different things. And Sekeita, do you want to continue?
So I can continue, but I don't know how you feel like you knew where I was going with this, because I didn't.
Because it has to do with providing that competent care, right? In other words, if you've never seen a toddler breastfeed, that may be something which is super shocking to you. Or, there may be other things that come up, right?
Yeah. So first off, I want to say I love this question, because these are the questions that a lot of times new practitioners have. But I have so many other questions that I would ask the person who asked this question back. for clarification to make sure I'm giving the correct answer. So with that being said, a couple things that occurs to me, and I could be reading this question totally wrong. So without clarification, what I'm going to say is that sometimes hospitals do have policies on whether or not you can serve in that capacity as far as seeing the outpatient. And I'm assuming you mean like private practice, or so that's a clarification. So what I'm saying to that is there would probably be a conflict of interest there to, if they called for someone else outside of the hospital system, meaning you would be operating outside of the hospital system, right? So I'm just saying, I don't know, certain hospitals have those types of, rules, and without really tapping into, where you work, how you work. And then, so I was a little confused also about, you were going to become an IBCLC, but you're working as an LC. So I would say whatever your scope is that's allowing you to work as the LC would be the same scope that you would be able to work with the any clients. And I think that's as comfortable as I am going into a response, because I need a little bit more context. So I'm sorry. You can always email.
She gave you context here.
Need further clarification.
There's a little context here. So they conduct the outpatient appointments in their office on the floor with the L&D postpartum. And so, I would also say that it would be helpful if in your hospital's policy that they did require the person to be an IBCLC. And the reason why is because this is all within the scope, inpatient, outpatient is all within the scope of practice of an IBCLC. And so that way, that would ensure that everybody is sort of covered on this one. I'm also going to mention that not only is it a different skill set, it's also a different matter of asking the right questions in order to be that investigator, that detective that Sekeita mentioned as well. And so, and also equipment is something which is important to consider. Do you have the equipment that you need in order to provide that care? And then finally, it's always the situation in not, if you see a baby who's compromised or a parent who's compromised, but when. And so when you encounter a parent or a baby who is compromised, what do you do then? And so having those additional pieces in place, for example, really good example, and I actually created a lactation program at my hospital where we were able to see outpatients, but I just had to make sure that I had everything. But then when the baby walks in who is, significantly underweight and or obviously, has a high level of bilirubin, what to do in those situations. And so that was always sometimes a little tricky as far as then which provider is responsible for the care of either the parent or the baby. And so those are considerations to do more so and to be like really very intentional with it, so that you've got buy-in at the hospital as well as from senior leadership to support something like this. Does that make sense, Sekeita? And hopefully to the person who answered the question, that made sense.
Yeah, I guess as long as it makes sense to the person asking the question. The only thing again is there was a follow-up question that said, so would you say that I am allowed to at least do the same assessment, provide the same care in an outpatient appointment as I do at the bedside for an inpatient?
It's not the same. It's slightly different. There's enough of a difference between that. For example, a parent who has nipple pain and trauma on day one is going to be different than a parent who has nipple pain and trauma on day 10. That there could be two different causes for it. And so being able to assess for both is something which is that sort of that full spectrum care that you want to be able to provide. Also, actually dealing with the trauma as well. I think that's something, the nipple trauma is something as well that could be important. So that's why insisting that the that you have that it's intended for IBCLC so that they can handle that full spectrum. And so the person also mentioned they've got a pediatric hospitalist team on hand for emergencies. Well, make sure they buy into this as well, because that's the other piece of it. And so that's good for the pediatric, for the infant, but what about the parent? And so ensuring that you've got that piece of it is important. But IBCLC does not differentiate the differences between an inpatient and an outpatient care that you provide. So
yeah, I was just gonna say, Angela, you hit the nail on the head. Sometimes in an outpatient setting, we think we are doing an actual lactation consult, and sometimes it's really doing help with psychiatric care. I've had the experience of having to really advocate and counsel a person to go to the ER because the acuity wise, there was the issue was, the priority, I should say, was the mental state versus the actual lactation concern. And so outpatient lactation consulting, you can bridge the two. I actually worked inpatient as a hospital, but I will tell you, if you were doing outpatient, say on someone who says, I want to wean, or I want whatever the case may be, on older babies or a 4-month-old, like that is totally different than the bedside. So I just wanted to clear that up. There's a few more questions, Angela. Someone says, hi, I'm just beginning this journey. I was a Leche League leader for over a decade. I've taken a break for about 6 years and would like to know how to go on to be a certified lactation consultant and then IBCLC. It says L, sorry. Where would the starting place be? I'm currently working as a certified pharmacy technician. Thank you for your time and expertise.
So your experience as a La Leche League leader is exceedingly valuable. And I would say, you have a lot of that experience supporting families for that length of time. So that's fantastic. Indeed, I would suggest if you wanted to, you could either do pathway 1 or pathway 3. It just depends on where you would be able to provide care if you want to do pathway 1 or 3. So investigate in your community, find out if there's anyone who would be willing to mentor you, and then just because the number of hours that are required is much less. La Leche League is a breastfeeding support organization, just like Lactation Education Resources. And so as we move from our pilot phase and into supporting all people who are CBSs in order to become board certified through pathway 1, that is something which you may want to consider, is to do the CBS training. You already have the, you already have a lot of that education, I know, with all the work that you did as a La Leche League leader. And yet, take that 95 hours, investigate which pathway you want to do first, and then decide which CBS course you want to take. And then hopefully by then we'll have the CBS available for everybody who would like, or the breastfeeding support organization supports available for everybody who would like to do it. Okay, Sekeita. And did I miss anything on that one?
No, you covered it. I don't have anything to add.
I will add, this person is a certified pharmacy tech. And so is there any way in the setting in which you currently work, you could support breastfeeding or chest feeding families, right? That's the thing, is that if you're some sort of a tech or some way that you can actually see people and support people, check your scope of practice to see if there's any way that you could sort of bring these two things together.
So I was looking to see if there were any more questions, and I don't see any more questions.
Okay, great. And also, just one thing, a couple of folks have said they do not have a medical background and they're curious about becoming an IBCLC. And I responded to the person in the chat, but I just want to say, I've been a lactation consultant for over 25 years, worked in a hospital, worked in a community setting, private practice, advocacy, and everything else, and I work exclusively as an IBCLC. Sekeita is a nurse and has all sorts of wonderful initials after her name. And, I think the two of us do complement each other quite well. And so it is wonderful that we both have our various lived experiences and backgrounds to come together to continue to support people, support families, continue to support families, as well as to educate folks. And so indeed, I do encourage you to consider becoming an IBCLC if that's what your passion says.
Yeah, I want to just jump in, Angela, because that, we talk about this, and this is for all my medical people, nursing people on this call. You're not going to like what I'm about to say, so I'm just going to say that. But the thing of it is no, you don't have to have a medical background. But what I will say is you have to take this profession serious. You have to be accountable for the knowledge. You have to understand anatomy and physiology. Yes, you have to understand how the brain works, the cranial nerves. You have to understand all of the things that that is in some medical and nursing programs, right? They're getting some of the same. You have to understand nutrition, some of the same courses. But no, your primary role is to manage lactation. And I will say that those that don't have that medical background, they are not, I don't want to use the word, oh, so I'm gonna get in trouble, but I keep it real all the time, tainted with all of the other things. People who are IBCLCs really and truly who value, so however serious you take your charge, doesn't matter whether you have the medical background. If you take your charge and really diving in, getting those knowledge, becoming competent, knowing how to use your resources, you will be able to manage lactation, clinical lactation support. And that's really what it is. It is that clinical piece. And so take it serious, because it is serious, because the type of care that you provide, whether it's skillful or not, could determine someone else's journey with their feeding their baby. And that could be a life or death situation. So in saying that, I do just want to say that, I'm passionate. I work with almost everyone on the team of people that I work with in my work don't have a nursing background. So, yeah.
Yeah, there you go. So good. Okay, great. And so to the person who wants help with a policy, just go ahead and email us at support@lactationtraining.com. That's the fastest way. And Julie and/or Wendy will forward it to us. And Sekeita and I are more than happy to help. So that's wonderful.
Yeah, absolutely.
Well, thanks everybody for joining us.
Questions.
I know, this
we
is
had
super
some different
fun.
type questions. Yeah, I loved it.
So thank you all very much for joining us today.
Yes, thank you for joining us. Good luck and best wishes on your journey. And if there's anything we can do, please don't hesitate, or clarify, please don't hesitate to reach out.
Thanks, everybody. Bye-bye.